What is the connection between tinnitus and phantom limb sensations? Imagine hearing a constant ringing or buzzing in your ears even when there's no sound around. Now think about feeling sensations in a limb that has been removed. Both are examples of how the brain can create perceptions without any external stimulus. This phenomenon is known as a phantom percept. Tinnitus is the perception of sound like ringing or buzzing without an actual sound source. Phantom limb sensations involve feeling pain or other feelings in a limb that no longer exists. Despite sounding different, they share some fascinating common roots in how our brains process sensory information. Both tinnitus and phantom limb sensations often happen after sensory loss. When someone experiences hearing loss, the brain receives less auditory input. Similarly, when a limb is amputated or nerve damage occurs, the brain loses sensory signals from that area. This loss of input causes the brain to undergo a process called cortical reorganization. Essentially, the brain rewires itself, and areas that used to process sound or limb sensations start to change their activity. This reorganization can lead to the brain generating false perceptions, like hearing phantom sounds or feeling sensations in a missing limb. Another key factor is central sensitization. This means the nervous system becomes more sensitive and amplifies signals, even if they are abnormal or non-existent. In both tinnitus and phantom limb sensations, this heightened sensitivity makes the phantom perceptions persistent and sometimes distressing. Brain imaging studies reveal that similar regions are involved in both conditions. For tinnitus, the auditory cortex shows abnormal activity, while for phantom limb pain, the somatosensory cortex is affected. Emotional and cognitive centers in the brain, such as limbic areas, also play a role, influencing how distressing these sensations feel. Stress and emotional trauma can make both tinnitus and phantom limb sensations worse. Many people notice that stressful events trigger or intensify their symptoms. Because of these shared mechanisms, some treatment approaches for phantom limb pain have inspired methods for managing tinnitus. For example, mirror therapy, which uses visual feedback to help rewire brain activity in phantom limb pain, has led to auditory-based therapies for tinnitus. One such approach is auditory mirror therapy, which involves manipulating sounds to disrupt abnormal brain activity and reduce symptoms. In essence, tinnitus and phantom limb sensations are connected through their nature as phantom percepts caused by sensory deprivation and brain plasticity. When the brain loses normal sensory input, it can generate these false perceptions. Understanding this connection helps researchers develop better treatments and highlights the brain's incredible ability to adapt, and sometimes misfire, when sensory signals are disrupted. For those experiencing tinnitus, especially after hearing loss, recognizing the brain's role in creating these phantom sounds can be empowering. Always remember, if you're dealing with persistent symptoms, consulting a healthcare professional is essential to explore personalized and effective management options.